Prava. Welcome back to another session of Modern Concept of Childcare. Now, in today's session, we will be learning about changing trends in pediatric nursing. So, here, as I told you, that we will be discussing about changing trends in pediatric nursing. Now, first, we need to understand what we mean by trends. Now, there is a way in which we provide care or we involve the family, and there is a proper way in which we conduct the whole treatment process, right? So, that is what is we mean by trend here. And now, if we see the current trends in pediatric nursing, we can see that there is a remarkable change in the field of pediatric nursing due to technological advancements and also the changing needs of the society. Apart from this, we also know that there is a persistent research which is going on in the medical field. Apart from this, we also know that there is an ongoing research which is going on in the medical field, due to which we get to know about a lot of diseases, and we are getting enlightened about the treatment processes, right? Yes. So, due to these things, there is a change in the pediatric in the trains in of pediatric nursing, and in today's session, we will be seeing that how pediatric nursing was before, and in current scenario, how does it work? Now we have pediatric medicine and also a field which is called as pediatric surgery, right? So if we see child health nursing, it is going through a tremendous advancement, uh, just like pediatric medicine and pediatric surgery. And whatever trends we will be discussing today, it is based on the researches which has been taking place, and due to this, as a result of these researches, we have modified trends in pediatric nursing, and the current trends in pediatric nursing are completely based on the researches which have been done in the field of pediatric nursing. So let us see one by one what are the current trends in pediatric nursing we have. So the first one here is family centered care. Then we have high technology care. The third one is evidence based practice. The fourth one is atraumatic care. And the fifth one is cost containment. And here we have one more, that is prevention and health promotion. So now we will be discussing about each of these topics, and we will see what actually we do in each of these fields. So first, let us discuss about the first point, that is family-centered care. So what is family-centered care? Now here from the name itself, you can understand that it is something where family is involved, right? So previously, what used to happen when a child is sick and the child is admitted in the hospital, the family used to be away from the child, and this family-centered care has been established with a philosophy. What is the philosophy? It is based on that the quality care can be provided in the environment where the child has the family support and the parents' love and affection. So, to do that, it is also important to look after the physiological and psychological health of the family. So, previously, what used to happen was when a child is sick, the child will be provided with proper treatment and care, and most of the times, the parents were unaware about their child's condition, and what is the best effective treatment, or how to take care of the child. Those things were were not known to the parents. So now in family centered care, what they do is they basically involve the parents, and where the parents are also aware about their child's condition and what kind of treatment or care the child needs. They are well aware about that. So we can say family centered care is not something which only provide nursing care or medical care to the child, but it is a holistic approach where they look after the psychological and the physiological health of the family as well, and they inform or they educate the parents about the child's condition, how to take care of the child, and what are their child's needs. So based on that, they design the treatment process, or we can say they design the nursing care or the medical care which will be provided to the child. So in family centered care, basically the family is also involved with the nursing and medical team in taking care of the child or in providing treatment or care to the child. Also, here we have one more thing that about the visiting hours. So previously, when the child used to get sick and they used to be admitted in the hospital, there were no specific visiting hours where the parents or the family members can go and visit the child and to know they can get to know about their child's condition. But now, in the current trains of pediatric nursing, we have this facility where the family members or the parents, they have visiting hours, or in that specific visiting hours the family members are allowed to see the child and get to know about their child's condition, and they can also provide care or provide love and affection to the child, which will help the child to recover in more faster way. Now, when we are talking about family centered care, there are two basic concepts. So what are those two basic concepts? Those are enabling and empowering. So what we mean by enabling? So as we can see that sometimes the parents or the family members, they are not aware of how to use their competences or how to use their skills in providing care to their child. So in enabling, basically what we do is there will be professionals who would help the family members to recognize that what skills they have which they can use for providing care to their child, and also they help the family members to acquire certain skills which are needed to provide care to their child. So this is one concept through which they involve the family members and they make them competent in terms of providing care to the child who is sick or who needs certain special care or treatment. So the next component is empowering, right? Now here we need to understand that what they basically do with empowering, or how empowering helps in family centered care. So as we know that as a nurse, it is our responsibility to help the family members to recognize the stress what they are going through is related to the disease condition of their child, right? But here in empowering, it is we also have the responsibility to help the family members with the interventions on how to cope up with the stress, or how to get rid of the stress. So basically in empowering, the nursing professionals or the nurses, they help the family members to get strengthened, and they help the family members to recognize what interventions they can take up to to get relief from the stress. And it is also important for the family members to take right decision at this time. But when the family members are under stress, they will be most of the time they are unable to take these important decisions on their own, right? So previously it was like the parents or the family members, they were not aware of their child's condition, and they had very limited information about their child's condition, and that's the reason most of the times they were unable in making a right decision at right time. So here in current trends, we have the concept of empowering, where we help the parents to to get strengthened and get stronger, and to how to and make them realize that how important it is to be stronger at this point of time, and how to take right decision, and how that right decision would help their child's condition. So this is all about enabling and empowering. So basically in family centered care, we have these two components, and with the help of these two components, we involve the family members in the providing the care to the child, and also in the whole treatment process. The next one is high technology care. So high technology care means you can understand that there is a technological advancement which happened over the years. And if we see the previous scenario where we had very limited accessibility towards the now high technological care, so you can understand that there is a technological advancement which has happened over the years. And if we see the previous scenarios, I think we had very limited accessibility towards the technologies, right? But now due to the technological advancement, uh, there is a significant change that we can see in medical field. For example, due to this advanced diagnostic technologies, we can detect many disorders even in the fetal period, right? But if we see the previous scenarios, or in the ancient periods, so what used to happen that due to lack of technologies, we there were many diseases which were left undiagnosed, or till the child is out of the mother's womb, we were not able to diagnose certain diseases, right? Certain genetic disorders. But now if we see the current scenarios or the current trends in pediatric nursing, we can see that there are many disorders which are being diagnosed at the fetal period itself. So when the fetus is inside the womb, and at that time itself we can diagnose many disorders. And you know how early diagnosis can help in treating the disease, right? So this, due to this high technology care, there is a remarkable change which has happened in the pediatric nursing. The next one is evidence based practice. So, what we mean by evidence based practice? Now, whatever practices we are following that should have an evidence, that is what we mean by evidence based practice. So, in nursing care, there are various practices which are followed by different institutions or hospitals, right? So, in nursing care, there are various practices which are followed in different institutions or hospitals. So if we see the previously what used to happen in pediatric nursing was that there was no evidence in the practices which were being followed by the nurses. But now whatever practices the nurses are following, it has an evidence, and based on the evidence itself, the nurses are allowed to follow certain practices. So, in today's scenario, it is very important for the nurse to make decisions on which evidence based practice to be followed, and which one is the best effective method. So, with this, how it helps the children, or how it is beneficial to the field of pediatric nursing, right? So previously, when there was no evidence-based practice, there were more risks involved in the treatment process, right? But here, whatever we are following in the current trends, that is evidence-based practice, for each and every practices we have an evidence, and based on that evidence we provide the treatment. So definitely there is less risks involved to the child, and less risk involved to the nursing professionals also. The next one is a-traumatic care. So a-traumatic care is something where we try to minimize the trauma in terms of uh, related to mental health trauma, or related to physiological trauma. So a-traumatic care, it is a provision of care. So a-traumatic care is the provision of therapeutic care through which we try to minimize the trauma in terms of psychological as well as physiological trauma to the child, and as well as to the families. So as I was telling you that previously, the family members were not taken care of when the child was ill, right? Yes. But now, as we are practicing family centered care and the current trends, we also take care of the family. We try to minimize their trauma, and we also try to strengthen them. So this through a-traumatic care, what they try to do is that the therapeutic care is designed in such a way that it minimizes, or it try to minimize the physiological or psychological trauma to the family members, as well as to the child. The next component is cost containment. Next is cost containment. So here we are talking about the cost, right? The expenditure which is involved in the whole treatment process. So basically, through cost containment, they try to reduce the cost of hospitalization. So as we were discussing that previously there was no evidence-based practice, and there was no such advancement in technologies, right? But now in today's scenario, or in current trends, what we can see is that there is high technology care. So for example, there is advanced diagnostic technologies, right? So many diseases are being diagnosed in an earlier stage, and this early diagnosis helps in saving a lot of money, and also in providing care to the child, and also in recovering in much more faster way. So previously there was no such evidence that which treatment would be effective for the child, and that's the reason there were trial and error method, and they used to try a lot of various treatment process, which used to involve a lot of finance, a lot of expenditure. But now we have evidence, and whatever practices we are following, it is based on the evidence. So we know what treatment is effective. It is because of the researches which have been taken place in the medical field. So because of that, we know that which treatment would be effective for which particular disease. And in this way, we are able to reduce the cost of hospitalization. And also there are, due to the high technology care, various equipments which has minimized the need of manpower. So in that way also, we the current trains in pediatric nursing reduces the cost of hospitalization. Now the last one is prevention and health promotion. So previously, in child health nursing, the focus was on only on the curative aspect of the health. So what is the curative aspect here? Now, what they used to do is, when a child is sick or when the disease has already occurred, their focus was on curing the disease and recovering the child from that particular disease. So this was about curative aspect. But now, if we see the current trends in pediatric nursing, we can see that it is not only the concept is not only about the curative aspect, but as well as it also focus on the preventive and the promotive aspect of health. So here, what we mean by preventive aspect of health or prevention of certain diseases. So here, what we mean by preventive aspect of health or the prevention of certain diseases. So basically, with the prevention or the preventive measures, what we do is that we try to prevent a disease. Okay. Now, how? So, as I told you that previously, our work was on once the disease has occurred, and after that, what interventions we can take, we were focusing on that. But now in the current trends, we start before the disease has occurred. So if, for example, there are certain communicable diseases which can be prevented. So if we take proper interventions or proper preventive measures, we can prevent the occurrence of that disease. So in this, we also educate the people about the hygienic measures, about the proper nutrition, and what is the importance of following these basic hygienic measures, or a proper diet, or proper sleep schedule, or the exercises, right? So this comes under the preventive aspect of a disease, or of the preventive aspect of the health, right? So now in pediatric nursing, the current trends of pediatric nursing, we also are focused on the preventive measures, how to prevent certain diseases, and what are the interventions that can be taken, that can be adopted to prevent these particular diseases. So as I was telling you that before, the nurses used to work only after the disease has occurred, right? Or the child health nursing was the focus of child health nursing was on the curative aspect, where the child is already suffering from the disease, and at that time, how to recover the child from that particular disease. But now in the current trends, we also the focus is on promote the preventive aspect, and as well as the promotive aspect. So what we mean by prevention or prevention of certain diseases. Now, here in prevention, what we do is we basically prevent the occurrence of a particular disease. So before the disease has occurred itself, we adopt certain preventive measures. We educate people about what are the preventive measures that they can take to prevent certain diseases, right? Now there are certain communicable diseases which can be prevented if we take certain measures, right? So about that, sometimes people are unaware that these diseases can be prevented, right? So it is now it is a very major job, or a responsibility, we can say, that we have to educate people. We have to educate the society or the family members of the child in how to prevent certain diseases. Okay. So even the prevention is more important than curing the disease here, because we are working where the disease has not occurred at all, and before that only we have already we are already educating people how to prevent the occurrence of that disease. So in this, basically, we educate people and the society and the community that what are the preventive measures that they should take to avoid, um, avoid getting a particular disease. For example, if we talk about COVID-19, so now we know that we should wear masks and the we should practice hand hygiene, and the proper hygienic measures should be taken to to avoid the occurrence of the disease. So these are the preventive measures which are being informed to people, and educated people are being educated on these things. So this is about preventive aspect of the health, where we are basically educating people how to prevent the occurrence of a particular disease. The next one is promotion, or we can say health promotion. So, what are these health promotion? Now, we have certain practices which makes us more healthy, or we can say that which makes us more immune towards certain diseases, right? So, it is also a very important part of child health nursing and the promotive aspect of health, right? So here what we basically do is that, so what we basically do in promotion is we educate the family members or the parents on how to promote their child's health. For example, there is a proper diet, or what is the importance of following a nutritious diet, and how that nutritious diet can prevent or make prevent many diseases, or how that can help the child to become more immune or more stronger towards certain diseases. Okay, so this is one component of promotion, health promotion measures, where we include nutritions, and as well as the hygienic measures. What are the hygienic measures that should be taken by the parents and by the family members, which will help the child in avoiding many diseases. And also the importance of exercise, or importance of play, or importance of a proper sleep schedule, or a regular checkup, how these things will improve the child's health, or how these things will improve the child's immune system. So we basically educate the family members on these things. So let us conclude today's session. In today's session, we learned about changing trends in pediatric nursing, where we learned that due to high technological advancements and the changing needs of the society, how the trends or the practices have been changed in the field of pediatric nursing. So in the current trends, we have seen that we have certain components or certain practices that we follow in the field of pediatric nursing. So we learned about family-centered care, how the families are involved in the in providing care to the child, and also we learned about high technology care. So how these advanced technologies have helped us with early diagnosis, and how it was in the previous years. We also learned about evidence-based practice. So whatever we follow here, or whatever practices we follow here now in the current trends, it is based on the evidence. And then we learned that in the current trends, it is also important. One of the important components is cost containment, atraumatic care, and one of the most important aspects of current trends in pediatric nursing is prevention and health promotion, right? So, this was all about today's session, and I hope you got a better insight about the topic. Thank you.